In this video, we'll be discussing trauma-related injuries. Let's first discuss abdominal injuries. The abdominal cavity contains solid organs, like the liver, the spleen, and hollow organs. Different organs react in different ways when subjected to trauma, thus presenting different symptoms. Causes: blunt trauma. For example, from the steering wheel in a motor vehicle accident, or from the handlebars in a motorcycle or bicycle accident. Penetrating injuries, such as knife injury or impalement. Illness and infection. Abdominal pain could be the sign of an illness such as appendicitis, infection or internal bleeding, and require prompt evaluation and medical aid. Signs and symptoms. A person with an abdominal injury may also have internal injuries. They may feel sick and could possibly go into shock. Abdominal injuries due to illness will cause site-specific pain and possibly a fever. Assessment of the casualty with abdominal injuries is difficult. As a consequence, the diagnosis tends to be missed. Internal rupture or bleeding can also be missed. Severe blood loss can be a complication of the abdominal injury. First aid. Check responses. Assess for shock. Call an ambulance and monitor until the ambulance arrives for the following. Shock. Lay them down and keep them still and warm. For severe pain, assist the casualty into a comfortable position. Flexed knees may help reduce the pain. Do not allow to eat or drink, even though they may feel extreme hunger or thirst. No wound. If the abdominal injury does not cause an open wound, lay them flat with their knees bent and treat as for shock until medical help arrives. Bleeding. Control bleeding using direct pressure or bandages. Embedded object. Leave in place and pat around the object. Protruding organs. If a trauma injury has caused the internal organs to protrude outside the abdominal wall, they must not be pushed back in. Doing so will only cause greater complications. They are to be covered with a moist, sterile dressing that will not stick, or plastic wrap. Now, let's discuss basic wound care. Skin varies in texture and thickness from one part of the body to the next. It is soft to allow movement, but tough enough to resist breaking or tearing. There are two broad categories of skin wounds. 1. Abrasions. The surface layer of the skin has been broken. Thin-skinned, bony areas such as knees, ankles and elbows are more prone to abrasions. The scraped skin of an abrasion can contain particles of dirt. These wounds should be cleaned, not scrubbed, and antiseptic applied. 2. Incised wounds, caused by sharp objects such as knives or shards of glass slicing into the skin. Depending on the injury, underlying blood vessels can be punctured, leading to significant blood loss. A severed artery is a medical emergency because the muscular action of this blood vessel will pump the entire blood supply out of the wound in just a few minutes. Infection control. Open wounds are prone to infection. Always wash your hands and use gloves. Avoid breathing or coughing on the wound. Clean in accordance with the type and the severity of the wound, including severity of bleeding. Do not wash or clean wounds that are severely bleeding. Stop the blood flow and get medical help. First aid. Clean with a non-fibre shredding material or sterile gauze soaked in normal saline or clean water. Do not use cotton wool or material that will fray or leave fluff. Don't scrub embedded dirt. This can traumatise the site even more. See a doctor if the dirt cannot be removed. Cover with a non-stick sterile dressing such as a Band-Aid or a non-adhesive dressing held in place with a non-allergic tape. Try not to touch the dressing surface before applying it. Change the dressing according to manufacturer's instructions. Our next topic to talk about is bleeding. The human body requires the correct amount of blood and fluid to be transported around the body in order to function properly. The blood transports oxygen to every cell in the body and then transports the waste products away from the cell. Bleeding is the loss of blood from the circulatory system. The loss can be from external or internal bleeding, ranging from minor through to severe or massive. First aid for any type of severe bleeding, whether internal or external, is critical in order to limit the loss of blood until emergency medical aid arrives. Always call 000 in an emergency. Reduce exposure to the risk of cross-infection. Always wear gloves and follow standard precautions. Internal bleeding. This may be difficult to recognise, but should always be suspected where there are symptoms and signs of shock. Causes. Internal bleeding can result from trauma or occur spontaneously, resulting from disease. If a casualty is suffering from internal bleeding, you may not be able to see the evidence of blood loss, as this blood loss may be contained within one of the body cavities. However, signs of shock will be obvious: pale, cold, clammy skin. Types of internal bleeding. 1. Visible. The most common type of visible internal bleed is a bruise, when blood from damaged blood vessels leak into the surrounding skin. Some types of internal injury can cause visible bleeding from a body opening. For example, bowel injury, head injury, lung injury, and urinary tract injury. 2. Not visible. It is important to remember that an injured person may be bleeding internally even if you can't see any blood. An internal injury can sometimes cause bleeding that remains contained within the body, for example, within the skull or abdominal cavity. First aid. Prompt medical help is vital. Check response. Conduct a verbal survey and listen carefully to what the person tells you about their injury. Lay them down and keep them still. Look for signs of shock. Cover with a blanket or something to keep them warm. Casualties' knees may be flexed, which may help reduce the pain. Don't give the person anything to eat or drink. Offer reassurance and manage after the injury. If the casualty vomits blood, place on their side and help eliminate. If they become unconscious, place them on their side. Monitor until ambulances arrive. External bleeding. Capillary bleeding, caused by small lacerations or abrasions, usually oozes and can easily be controlled with a pad and bandage. Venous bleeding, usually caused by lacerations, which can bleed freely but can be adequately controlled. Arterial bleeding, usually caused by a severe laceration which spurts vigorously because the artery has been sliced, causing the heart to pump out blood with each contraction. Immediate action is required, as the casualty can lose a large amount of blood quickly. Nose bleeding. Bleeding from the nose is usually not severe. Sit the casualty upright, ask them to tilt their head forward to avoid blood flowing down the throat. Using the thumb and forefinger, ask the casualty to squeeze the nostrils shut. Direct pressure over the soft part of the nostril below the bridge of the nose. Remain seated and hold for at least 10 minutes. On hot days or after exercise, it might be necessary to maintain pressure for at least 20 minutes. Release the hold gently and check for bleeding. If the bleeding has stopped, avoid blowing your nose or picking at it for the rest of the day. If bleeding does not stop after 20 minutes, seek medical attention. External bleeding. Lay the casualty down, restrict movement and reassure. Raise the injured area above the level of the casualty's heart if possible. Instruct the casualty to place pressure directly on their wound, if you're able to, so you can get the padding, dressing and bandages ready. If the casualty is unable to assist, apply pressure yourself using gloved hands or a pad. Pull edges of the wound together if required before applying a dressing or pad. Apply a pad over the wound and secure it firmly with a bandage. If blood saturates the initial dressing, do not remove it. Pad over the top and secure with another bandage. If bleeding continues through the second pad, replace the second pad and bandage. If major bleeding continues, remove the initial pad or pads to ensure that a specific bleeding point that can be controlled by direct pressure has not been missed. Embedded objects. For example, a knife or a stingray barb. Do not remove the object. It may be plugging the wound and stopping the bleeding. Place padding around or above and below the object and apply pressure over the pads. Amputation. Apply a pad over the wound and secure it firmly with a bandage. Place the amputated body part into a clean plastic bag and seal it completely. Ensure that it's waterproof. Place the plastic bag into another plastic bag and seal it again. Place the plastic bags into a container of cool water. Make sure no water touches the amputated part. If normal bleeding control, such as direct pressure and correct bandaging, does not stop the bleeding and the bleeding is life-threatening, follow procedures for a tourniquet. Tourniquet. As a last resort for life-threatening bleeding only, where other methods of controlling blood have failed, for example, traumatic amputation of a limb or major injuries with massive blood loss, e.g. a shark attack, apply a bandage of at least 5 centimetres wide, high above the bleeding point. Tight enough to stop any circulation to the injured limb and control the bleeding. Note the time of the application and provide this information to paramedics. Do not apply over a joint or wound and do not cover with bandages or clothing. Once applied, a tourniquet should never be removed until a casualty receives specialist care.